Free NCLEX RN practice exam to study for your NCLEX RN licensing test. Question 1. A patient is to get an MRI of the abdomen. Which of the following instructions should the nurse give the patient? Do not wear metal objects during the MRI, including jewelry. Do not take oral medications up to 12 hours after the MRI. Do not urinate prior to the MRI. Do not eat solid foods 12 hours prior to the MRI. Metal objects should not be used near an MRI as the magnetic field can pull objects and cause harm. Unless otherwise instructed, it is safe to eat, urinate, and take meds. Question 2. In which of the following ways can the nurse promote the sense of taste for an older adult? Mix foods together on the dinner tray. Avoid cologne, air fresheners, or room deodorizers. Encourage the client to chew food thoroughly. Discourage the use of salt or seasonings with prepared food. Chewing food thoroughly results in longer contact with taste buds, which helps older adults whose sense of taste may be diminishing. Question 3. Which of the following advisements should a patient suffering from GERD receive? To eat high-protein, low-fat foods. To stay upright 2 to 3 hours after a meal. Limit the intake of acid-stimulating food and drink. All of the above. High-protein/low-fat diets help prevent symptoms. Staying upright keeps pressure off the esophageal sphincter, and limiting stimulants prevents heartburn. Question 4. A portion of a building collapses after an earthquake. Which of the following patients should be first priority? A 20-year-old male with a head laceration and substantial bleeding. A 42-year-old female with dyspnea, oxygen saturation of 88%, and a pulse of 120 bpm. A 50-year-old male with partial amputation of the right foot, with pulse present. A 12-year-old female complaining of shoulder pain and a large bruise. This patient is experiencing respiratory distress, hypoxia and tachycardia, and needs immediate intervention over the others. Question 5. At the beginning of the shift, which of the following situations should the nurse give first priority? A diabetic client with a blood glucose level of 195 mg/dl. A family member of an elderly client who has questions. A client with COPD with an oxygen saturation of 84%. A client who requires assistance to use the bathroom. Airway, breathing, and circulation, ABCs, are the priority. The client with COPD has a compromised breathing status. Question 6. Mr. W has orders for a physical therapy consult, but 12 hours later, no one has come. Which is the most appropriate action? Call the supervisor and file a complaint. Contact the physician to notify him that orders were not carried out. Assess the client's activity level by assisting with ambulation. Contact the physical therapy department again and repeat the order. Clear communication between disciplines is required for collaboration. Repeating the order directly to the department is the appropriate next step. Question 7. The B in the SPAR acronym stands for background, basic, beginning, break. SPAR stands for situation, background, assessment, and recommendation. It is a communication tool used between healthcare providers. Question 8. A patient has multiple questions regarding surgery after being asked for consent. Which is the appropriate response by the nurse? You have already signed the consent form, so we need to proceed. I will answer any questions that you have about the risks/benefits. I will call the medical director to report the physician. I will call the doctor and have him return to answer your questions. The physician is responsible for discussing the procedure, risks, and benefits. The nurse's role is to facilitate that communication. Question 9. A patient is suffering from heart failure. Which of the following would be recommended as part of the healthcare plan? Discouraging a diet of fruit and vegetables. Checking for swelling of the lower limbs. Encourage the daily intake of fluids. Encouraging vigorous exercise. Edema, swelling, is a common finding in CHF due to impaired circulation. Fluid intake is usually restricted, not encouraged. Question 10. The spouse of a patient asks for information about the treatment plan. How should the nurse respond? Ask the patient for the information. I cannot give you information on any patient. The doctor will speak to you about the treatment plan. Can you give me the patient's social security number? Under HIPAA, protected health information, PHI, cannot be shared without the patient's explicit consent. Question 11. A patient says, I'm not sure I will be able to take care of myself at home. Who is the most appropriate team member to report this to? Doctor, physical therapist, case manager, director of nursing. The case manager handles discharge planning and assesses the patient's living and financial situation. Question 12. A post-op amputation patient refuses to look at the limb and talks about the nurse's personal life instead. Which care plan is priority? Disturbed body image, altered sleep pattern, impaired memory, impaired social interaction. Refusing to look at the site of a lost limb is a classic indicator of a disturbed body image. Question 13. Which of the following symptoms would support a diagnosis of Crohn's disease? Fatigue and headache, rectal cramping and bleeding, stomach swelling and gas, all of the above. Rectal cramping and bleeding are the most consistent clinical manifestations of Crohn's disease. Question 14. A nurse is teaching a seminar on patient confidentiality. Which statement should be included? Verbal consent is sufficient to allow family to see records. Family at the hospital are entitled to an update. All hospital staff may have access to medical records. Consent to disclosure is implied when a patient is transferred to another provider. Consent for disclosure is implied for the purpose of continuity of care during a transfer between facilities. Question 15. The RN asks a CNA for help with a post-hysterectomy patient, which is an inappropriate delegation. Asking the CNA to ambulate the patient. Asking the CNA to empty the Foley catheter. Asking the CNA to teach the patient how to care for her incision. Asking the CNA to check a blood pressure. Teaching and assessment are roles of the nurse and cannot be delegated to unlicensed assistive personnel. Question 16. Which of the following patients would not require a mask to be worn while providing care? A 10-year-old female with varicella, a 67-year-old African male with tuberculosis, a 52-year-old female with shingles, a 40-year-old male with COVID-19. Shingles requires contact precautions, gloves/gown. Varicella, TB, and COVID-19 require masks, airborne or droplet precautions. Question 17. Which infectious control method should be used when caring for a patient with bacterial pneumonia? Wear a mask when taking vital signs. Do not allow flowers in the patient's room. Require the patient to use disposable eating utensils. Do not allow visitors. Bacterial pneumonia is spread via droplets. Droplet precautions require a mask to prevent inhalation of bacteria. Question 18. A nurse is advising a patient with chronic fatigue syndrome on infection control. Which statement indicates understanding? I am going to a basketball game tonight. I should avoid anyone with cold symptoms. I should have a blood test. I am not going to attend functions with large crowds. CFS patients may be more susceptible to viruses. Avoiding people with cold symptoms is a proactive infection control measure. Question 19. Which of the following is an example of client handling equipment? Wheelchair, height adjustable bed, shower chair, call light. Height adjustable beds allow the nurse to raise the client to a proper working height, reducing the risk of lifting injuries. Question 20. A CNA uses hand sanitizer after leaving a room marked as enteric contact precautions. What is the nurse's response? Nothing, as the CNA has appropriately washed their hands. Tell the CNA they need to wear a mask in the room. Tell the CNA they should dispose of their gloves outside the room. Tell the CNA they need to wash their hands with soap and water. Enteric precautions, like C. diff, require soap and water because alcohol-based sanitizers do not kill the spores. Question 21. Which complication is associated with premature rupture of membranes? Vaginal or cervical lacerations, shoulder dystocia, uterine rupture, chorioamnionitis. Chorioamnionitis is an infection of the amniotic sac/membranes that can occur when the sac is no longer intact. Question 22. Which of the following would alert the nurse to respiratory distress in the newborn? Respiratory rate of 50 breaths per minute, acrocyanosis, circumoral cyanosis, nasal flaring and retractions. Nasal flaring and retractions are signs that the newborn is using extra effort to breathe. Question 23. Which of the following statements to a type 2 diabetic patient is correct? Eat less fruits and vegetables and more grains. Try to wear closed-toe shoes whenever ambulating. Minimize physical activity to prevent fatigue. Check your blood sugar only after meals. Closed-toe shoes protect feet from injury, which is critical due to diabetic neuropathy and poor wound healing. Question 24. What information should be included in a seminar on advance directives? A patient needs agent approval to change an advance directive. A patient must appoint a DPOA for health care upon admission. A facility must provide material advising patients of their rights to declare treatment desires. A facility is required to provide an attorney for a living will. Federal law, Patient Self-Determination Act, requires facilities to provide information about the right to accept or refuse treatment. Question 25. A patient with CHF is being discharged. Which statement indicates understanding? I can drink as much fluid as I want. I should notify my doctor if my feet start to swell. Weight gain of 3 to 5 pounds in one day is expected. It is normal to have difficulty breathing at night. Lower extremity edema indicates increased pressure on the heart and must be reported. Question 26. A pregnant woman has a 1-hour glucose screening value of 160. The nurse anticipates the physician will order a 3-hour oral glucose tolerance test. Do nothing as this is a normal value. Ask that the patient avoid sweets. Repeat the test in 3 weeks. 160 mg/dl is abnormal for a 1-hour screen. A 3-hour test is the diagnostic follow-up for gestational diabetes. Question 27. A patient has chest pain. An EKG is performed. Which of the following is considered abnormal? A non-elevated ST segment, PR interval of 0.12 to 0.20 seconds, smooth P waves, wide QRS complex. A wide QRS complex is often associated with ventricular arrhythmias or conduction delays. Question 28. A nurse is assessing a patient after a bowel resection, which is a concern for a surgical complication. Distended abdomen and absent bowel sounds. Borborygmi is heard upon auscultation. The incision edges are pink. The patient reports pain 4 out of 10. Distended abdomen and absent bowel sounds indicate a paralytic ileus, a common post-op complication. Question 29. What level of suction pressure should be applied when suctioning an adult's endotracheal tube? 70 to 80 mmHg, 100 to 120 mmHg, 150 to 170 mmHg, 200 mmHg. Standard suction for an adult is 100 to 120 mmHg. Pressure over 150 mmHg can cause hypoxia or tissue damage. Question 30. Which intervention will reduce hypoxia during endotracheal suctioning? Hyperoxygenate the patient for 30 to 60 seconds prior. Administer 15 cubic centimeters of sterile fluid into the tube. Suction for no longer than 30 seconds at a time. Wait 30 seconds after suctioning before attempting again. Hyperoxygenation provides a buffer to prevent the drop in oxygen saturation that occurs during suctioning. Question 31. Which condition is a contraindication for performing a diagnostic peritoneal lavage? A client who is 9 weeks pregnant. A client with a femur fracture. A morbidly obese client. A client with hypertension. Morbid obesity makes identifying landmarks difficult and increases the risk of complications from anesthesia. Question 32. An elderly man sits in a chair all day long. What is he at risk for? Pressure ulcer, deep vein thrombosis, constipation, all of the above. Immobility increases the risk of skin breakdown, blood clots in the legs, and slowed GI motility. Question 33. Which of the following would be included in instructions for using a walker? While putting body weight on your hands, step into the walker. Hold the upper hand grips. When seated, push off the chair to come to a standing position. All of the above. All these points ensure safety, proper weight distribution, and stability while using a walker. Question 34. True or false, a patient is not to eat or drink anything 24 hours before a colonoscopy? True. False. False. Clear liquids are usually allowed until the night before or a few hours before the procedure. Question 35. A patient is having a tonic-clonic seizure. A nurse should take which of the following steps? Put a pillow under the patient's head. Put restraints on the patient. Use a tongue blade on the patient. Lay the patient on his back. A pillow protects the head from injury. Turning the patient on their side is also a priority to prevent aspiration. Question 36. Which of the following patients has an increased risk of breast cancer? A 44-year-old who has had 5 children, a 28-year-old who is breastfeeding, a 35-year-old who started her menstrual cycle at age 12, a 61-year-old who has not had children. Nulliparity, never having children, and advanced age are significant risk factors for breast cancer. Question 37. Which of the following is a potential complication from prolonged immobility? Pneumonia, stiffening of the joints, deep vein thrombosis, all of the above. Pneumonia, stasis of secretions, joint contractures, and DVT are all major risks of immobility. Question 38. When assessing an African American client for an early pressure ulcer, what might the nurse find? Skin has a purple/bluish color. Capillary refill is 1 second. Skin appears blanched at the pressure site. Tenting appears when checking skin turgor. In darker-skinned clients, blanching may not be visible. A purple or bluish hue indicates tissue damage. Question 39. Which practice will help to reduce the risk of a needle stick injury? Only expose the needle once ready to enter the room. Always place the cap back on a needle after use. Keep a sharps container nearby. Pass needles between nurses using handover technique. Disposing of sharps immediately in a nearby container is the most effective way to prevent injury. Never recap needles. Question 40. A drug form in which medication particles are instilled into a liquid and combined through agitation is called suspension, elixir, syrup, tincture. A suspension requires shaking, agitation, to redistribute particles that settle at the bottom. Question 41. Which information about progesterone is appropriate to include in teaching? Progesterone helps the body to maintain pregnancy. Progesterone stimulates the breasts to secrete milk. Progesterone causes uterine contractions during delivery. Progesterone causes masculine characteristics in women. Progesterone prepares the uterine lining for implantation and maintains it throughout pregnancy. Question 42. A patient has a hemolytic reaction during a transfusion. What is the first action the nurse should take? Fill out an incident report. Stop the transfusion and call the physician. Immediately administer corticosteroids. Start in 4 bolus of normal saline. The priority is to stop the infusion of the incompatible blood immediately to prevent further harm. Question 43. Which of the following is the antidote to warfarin toxicity? Calcium gluconate, insulin, protamine sulfate, vitamin K. Vitamin K is used to reverse the effects of warfarin. Protamine sulfate is the antidote for heparin. Question 44. A patient is asking why they need to use an incentive spirometer. Which of the following is not a reason? To decrease lung capacity, to gently exercise the lungs, to improve recovery time, to prevent pneumonia. Incentive spirometry is used to increase/maintain lung capacity and prevent atelectasis and pneumonia. Question 45. A patient had a left hip replacement. What non-pharmacological intervention would not be appropriate? Reposition the patient onto the left side, massage the patient's back, lower the head of the bed and elevate the legs, apply a warm pack to the back. Patients should not be positioned on the operative site to avoid pressure and potential dislocation/poor healing. Question 46. A woman in labor, 5 centimeters dilated, declines pharmacologic intervention. Which therapy is not appropriate? Pudendal nerve block, guided imagery, massage, TENS unit. A pudendal nerve block involves the use of local anesthetic, medication, and is a pharmacologic intervention. Question 47. Which medication is a patient with atrial fibrillation likely to receive long-term? Warfarin, heparin, furosemide, albuterol. Warfarin is an oral anticoagulant used long-term to prevent stroke and clots in patients with AFib. Question 48. A patient is to receive ceftriaxone. The nurse is currently infusing lactate ringers. What is the first action? Mix the ceftriaxone into the primary infusion. Insert as secondary 4. Stop the LR and start the ceftriaxone. Check the 4 compatibility of the 2 medications. Nurses must check compatibility before mixing or running medications through the same lysite. Question 49. A 200 pounds patient has a prescription for a dopamine drip at 5 mg/kg/min, 400 mg and 500 ml. What is the ml/hr rate? 17, 24, 34, 44. Calculation: 90.7 kg x 5 mg x 60 minutes/1000 mg/mg*, 500 ml/400 mg equals 34 milliliters per hour. Question 50. A patient is prescribed 650 mg of Tylenol. Pills on hand are 325 mg. How many pills are administered? 2, 3, 4, 5. 650 mg divided by 325 mg per pill equals 2 pills. Question 51. All but which of the following medications may cause urinary retention? Benadryl, diphenhydramine, Xanax, alprazolam, Liorcil, baclofen, hydrodiaryl, hydrochlorothiazide. Hydrochlorothiazide is a diuretic that increases urination. The others are known to cause retention. Question 52. A 143 pounds patient is prescribed garamycin at 2 mg per kilogram, 100 mg in 50 milliliters. How many ml are administered per dose? 45, 55, 65, 75. Calculation: 143 pounds equals 65 kilograms. 65 kilograms x 2 milligrams per kilogram equals 130 milligrams. 130 milligrams x 50 milliliters/100 milligrams equals 65 milliliters. Question 53. Which nursing intervention is appropriate for a client who is suffering from a fever? Avoid giving the client food. Increase the client's fluid volume. Provide oxygen. All of the above. Fever increases metabolism and heart rate, requiring more fluids and oxygen to maintain stability. Question 54. A client sweating profusely in heat with electrolyte imbalance is most likely suffering from malignant hyperthermia, heat exhaustion, heat stroke, heat cramps. Heat exhaustion involves heavy sweating and dehydration. Untreated, it leads to heat stroke. Question 55. Which of the following is not an appropriate use of restraints? Checking skin/neurovascular status every 30 minutes. Tying restraints to the side rails. Discontinuing when risk of harm is gone. Offering toileting/ROM every 2 hours. Restraints should be tied to the bed frame using a quick-release knot, never the side rails. Question 56. Which of the following symptoms would a patient exhibit with hyperthyroidism? Intolerance to cold, decreased bowel movements, slow heart rate, none of the above. Hyperthyroidism causes intolerance to heat, rapid heart rate, and increased bowel movements. Question 57. Which of the following lab tests would be considered point-of-care testing? Urinalysis, sputum culture, complete metabolic panel, blood glucose. Point-of-care, POC, tests are done at the bedside with immediate results, like a fingerstick glucose. Question 58. A patient has had diarrhea for 72 hours. Which symptom would support a diagnosis of hypovolemia? Light-colored urine output, decreased pulse rate, wet mucous membranes, dizzy spells. Hypovolemia causes dizziness due to low blood pressure and decreased perfusion to the brain. Question 59. pH 7.25, HCO 317, PaCO 231. Which acid-base imbalance is present? Respiratory acidosis, metabolic acidosis, metabolic alkalosis, respiratory alkalosis. The low pH 7.35 and low HCO 322 indicate metabolic acidosis. Question 60. Which of the following is classified as a prerenal condition that affects urinary elimination? Nephrotoxic medications, pericardial tamponade, neurogenic bladder, polycystic kidney disease. Prerenal conditions occur before the kidney, such as heart issues that reduce blood flow to the kidneys. Question 61. A patient receiving a blood transfusion says, "I feel hot, my stomach hurts, and I am having difficulty breathing." First action: notify the physician immediately. Stop the infusion. Take vital signs. Call a code. At the first sign of a transfusion reaction, the infusion must be stopped immediately. Question 62. Which of the following is an organizational factor that affects workplace violence? Clients who have short hospital stays, the presence of security guards, restricted client areas, understaffing of nursing personnel. Understaffing leads to delays in care and increased frustration, which are risk factors for violence. Question 63. A patient's spouse died 3 months ago. Patient wants to give away a collection of artwork. Best response: did Tom ask for the artwork? Are you planning to commit suicide? Does Tom know you want to give him the artwork? Why do you want to give the artwork away? Giving away prized possessions after a loss is a warning sign for suicide. The nurse must ask directly. Question 64. Which of the following is an expected milestone for a 2-year-old? Has a 300-word vocabulary, uses one hand to turn pages of a book, runs with a wide stance, all of the above. By age 2, children have reached these speech, fine motor, and gross motor developmental milestones. Question 65. Injuries appear indicative of abuse. Which action should the nurse take? Question the couple together. Inform the spouse the injuries look like abuse. Inform the patient she must speak to the police. Question the patient about abuse with the spouse out of the room. Victims of abuse must be interviewed alone to provide a safe space for them to speak honestly. Question 66. A schizophrenic patient says, "The staff is employed by the CIA to take me out." Best response: the CIA protects us and is not out to hurt you. No other patient thinks that. It must be frightening thinking people want to hurt you. When did you first start having these thoughts? The nurse should acknowledge the patient's feelings without reinforcing the delusion. Question 67. A patient with acute appendicitis says they feel better and don't think they need surgery. Best response: I will have your spouse explain it. I will call your doctor to explain the procedure to you. I will explain the procedure and answer questions. Your appendix may rupture and cause serious problems. If a patient rethinks surgery, the surgeon, physician, must be notified to re-explain the risks and benefits. Question 68. Which method is the last resort for a patient experiencing mild anxiety? Therapeutic communication, deep breathing, progressive muscle relaxation, administration of Haldol. Non-pharmacological intervention should always be attempted before administering antipsychotics for anxiety. Question 69. A terminal cancer patient and family avoid talking about the diagnosis and change the subject. This is closed awareness, mutual pretense, open awareness, powerless assessment. Mutual pretense is when both parties know the truth but agree, implicitly, to avoid the topic. Question 70. Adults sharing finances and living conditions in a home with unrelated children. This is a blended family, communal family, foster family, extended family. A communal family consists of unrelated people living together and sharing resources like a family unit. Question 71. A student blames his instructor for a poor grade, saying she doesn't like him. This is regression, dissociation, rationalization, substitution. Rationalization is making excuses or blaming others to avoid taking responsibility for one's own failure. Question 72. A patient is prescribed lithium for bipolar disorder. Which statement is concerning? I need to drink plenty of water. I will immediately stop this medication if I become pregnant. I will check my lithium levels regularly. I need to avoid ibuprofen. Abruptly stopping lithium can cause a severe relapse. Medication changes during pregnancy must be managed by a doctor. Question 73. A nurse is talking about body changes with a bilateral mastectomy patient. Which action is most appropriate? Provide a room that offers minimal distractions. Ask closed-ended questions. Write detailed notes during the conversation. Ask personal questions about the client's background. Providing a private, quiet environment encourages open communication about difficult emotional topics. Question 74. Which question is most appropriate for assessing a client's personal identity? What is your educational background? Are your parents still living? What do you like about your life right now? Where do you see yourself in 10 years? This question focuses on the client's self-perception and how they see their own strengths and current status. Question 75. A nurse palpates a pulse on the inner side of the ankle, behind the medial malleolus. This is the dorsalis pedis, popliteal, posterior tibial, femoral. The posterior tibial pulse is located behind the medial malleolus, inner ankle bone. Question 76. A client with a new diagnosis of atrial fibrillation is at risk for hypertensive crisis, cerebral vascular accident, seizure-like activity, peripheral vascular disease. Atrial fibrillation allows blood to pool in the atria, forming clots that can travel to the brain and cause a stroke. Question 77. A patient has a change in neurological status, difficulty speaking. First action: perform a neurological exam. Contact the healthcare provider. Assist the client back into bed. Check the client's blood sugar. The nurse must assess the patient first to collect data, like the NIH stroke scale, before notifying the doctor. Question 78. What is the most important data to collect after a patient shows stroke symptoms? The last time the client ate or drank. The time the neurological symptoms started. The time the last dose of morphine was given. The amount of time the client slept. The onset time determines eligibility for thrombolytic therapy, like TPA, which must be given within a specific window. Question 79. Which action is the priority for a client experiencing a potential CVA? Transport the client to CT. Obtain 4-access X2 sites. Perform a 12-lead ECG. Call the X-ray technician. A CT scan is the priority to determine if the stroke is ischemic or hemorrhagic, which dictates the treatment. Question 80. A patient is receiving tenecteplase, TNK. Which statement is most concerning? Can I please have water? Is there anything I can have for a headache? Do you think my speech sounds better? Can I have something for anxiety? A headache during thrombolytic therapy can indicate a brain bleed, a life-threatening adverse effect. Question 81. Which statement by a post-stroke patient indicates a proper understanding? I should cut back on smoking cigarettes. Avoiding activity will prevent bleeding on warfarin. I am not likely to have another stroke soon. Taking warfarin every day as prescribed is important. Compliance with anticoagulants is essential to prevent recurrent strokes in patients with atrial fibrillation.